Hello, my name is Dr. Mike Durkin from the National Institute of Healthcare Research Patient Safety Translational Research Centre, real mouthful. And I'm proud to be able to share with you today our agenda. So welcome to our conference based at Imperial College London to recognise the 2022 World Patient Safety Day. This day was first suggested in 2016 in London at the inaugural Ministerial Global Summit on Patient Safety, co-hosted by the UK and Germany. At the second summit in Bonn in 2017, WHO launched its third global challenge on patient safety, medication without harm. This was to add to the previous challenges on clean hands and safe surgery. The aim of this third challenge was to reduce harm from medication error by 50% in 5 years. We are now 5 years on, and what have we as leaders and advocates of patient safety achieved within and over the last 5 years? Well, we haven't been very successful. Medication error now costs more than $50 billion per year across the globe, and that's greater than 1% of current global health budgets. In the UK alone, we estimate greater than 250 million errors, of which 66 million are potentially clinically significant, and at the unacceptable cost of 1,000 lives lost forever. Key to our understanding of this is our ability to collect reports from all elements and settings of healthcare. Our reporting system in the UK is the largest system in the world and is a direct consequence of the work to create key policy initiatives to reduce avoidable harm in healthcare, direct working between politicians, practitioners, and the public. This policy development of enabling national and local reporting and analysis has identified that most errors occur in prescribing and administration. The wrong drug, the wrong patient, the wrong dose, or the wrong route. But important further key policy initiatives shifts now to ensure the continual involvement and empowerment of all patients and their carers in the control and management of their medications. This collaboration between practitioners, politicians, and the public has already borne significant fruit with our work to reduce harm from VTE, whereby a concerted effort to risk assessment, appropriate prophylaxis, and audit has reduced deaths from hospital-related VTE by at least 20% and saved countless patients from the long-term consequences of VTE. This importance of collaboration has had a very long and positive influence through the efforts of doctors such as Ernest Codman at the beginning of the last century in Boston, who brought a structured case note review, Deming, the father of quality improvement and quality processes through engineering capabilities, and Leap and Reeson, through whose leadership brought modern-day error analysis to healthcare. And then Don Abadian, who reminded us of the importance of structure, of the relationship between structure and process to improve outcome. And more recently, from Don Berwick of IHI, Gary Kaplan, Virginia Mason, and Tejal Gandhi of the Lucy and Leap Institute. In particular, Don carried out his review of the quality and safety of the NHS and challenged us to become a system of learning top to bottom and end to end. And we now have a fully embedded patient safety collaborative system of 15 and Q fellowships as key elements of a national patient safety improvement culture. Today, we welcome an opening address from Professor Ara Darzi, a leader in developing quality systems across the NHS, to kick off the conference with his views on medication safety improvement. Ara will be followed by an expert keynote from Professor Bryony Franklin, who will take us through the global challenge and the 5 moments in medication safety. We're extremely proud that Bryony is with us, as she has brought together the soon-to-be-released WHO Medication Safety Guide as part of the WHO Patient Safety Curriculum Guides. Dr. Alpana Mayer who you will know as the Scottish lead on medication safety, as well as a key advisor on patient safety to WHO, will then share a global discussion together with Professor Priya Galapati from Sri Lanka and Dr. Arjun Chimidamba from the patient safety team in Mongolia. They're all great current partners of ours in our Global Patient Safety Collaborative and well worth a great listen. A key element of the Global Challenge and also the Global Patient Safety Action Plan is to encourage and actively support patient and carer involvement and empowerment in managing their own medication safety. We're delighted, therefore, that we have a real expert in this field to lead our panel on this aspect of the challenge. Anna Lawrence-Jones, as chair, will be joined by Sarah Garfield and patient partners to discuss current medication safety research and service improvement for patients. Our conference will then be joined by a further keynote from Jeremy Hunt, who you know as the chair of the Parliamentary Health and Social Care Select Committee. He's also, however, become a key global political leader on patient safety and is an active supporter of the WHO Global Patient Safety Action Plan and our own Global Patient Safety Collaborative, for which Imperial College is proud to provide the academic leadership. So a truly jam-packed day with great content and a really exciting opportunity to listen. We'd also like you to share content and views through your social media platforms, so don't hold back. I hope you enjoy the conference today and stay in touch with us at Imperial. Thank you for listening.